All right, let's talk about something really important for anyone using home oxygen. We're going to break down exactly why your prescribed dose is so critical and explore the hidden dangers of getting it wrong.
So let's set the scene. Something many of you might have felt. You're on your home oxygen, you're feeling more breathless than usual. And what's your first instinct? Just turn up the dial a little bit, right? It just seems like the logical thing to do. But today, we're going to look at why that simple impulse might not just be wrong, but could actually be pretty dangerous.
You see, here's the absolute first thing we have to get our heads around. Home oxygen isn't just, cleaner air. It's a medical gas. It's a prescribed medication, plain and simple. Think about it this way. You wouldn't just decide to double your dose of a heart pill without talking to your doctor, would you? Well, the exact same principle applies here. It's a very specific treatment for a very specific problem.
And look, don't just take my word for it. Authoritative sources like Asthma and Lung UK are incredibly clear about this. This quote really says it all, doesn't it? Oxygen is a medicine. Too much can be dangerous. That flow rate you were given wasn't just a suggestion. It was prescribed for you specifically after a really careful, detailed assessment.
So what does that very careful assessment actually look like? Well, it's not a guess, that's for sure. The process for figuring out your exact prescription is a multi-step, highly controlled thing, and for a very good reason. Let's walk through it.
The whole process is incredibly methodical. First, it usually starts with a referral when your oxygen levels, your SpO2, are consistently hanging out at 92% or lower. Then comes the really important part, a blood gas test. This isn't just a finger clip. This measures the actual oxygen pressure in your arteries. And from there, the clinicians don't just pick a number, they titrate. That means they start you out low, maybe at 1 liter per minute, and they slowly, carefully increase it until your body hits its perfect target level. And they only finalize that prescription when you're clinically stable, not during a sickness or a flare-up.
Okay, so we've established the prescription is super precise. But why? What's the big deal if you turn it up a little? This isn't just a case of too much of a good thing. There is a specific, hidden danger that we absolutely need to understand, and it has to do with something you exhale.
And that hidden danger is a condition called hypercapnia. All that means is there's too much carbon dioxide, or CO2, building up in your blood. For some people, especially those with lung conditions like COPD, the body's primary alarm bell to take a breath is a low oxygen level. So what happens if you give it too much oxygen? Well, you can accidentally switch off that alarm bell. Your body thinks, oh, plenty of oxygen here, no need to breathe so hard. Your breathing can actually slow down. And when that happens, you don't blow off enough CO2. It just builds up. And that's when things get dangerous.
So you can see, this is a real balancing act. Your oxygen prescription is treating one problem, hypoxemia, which is low oxygen. But if you take too much, you can cause a totally different and just as serious problem, hypercapnia, which is high CO2. It's like a delicate seesaw, and your prescription is that perfect, tiny balance point right in the middle. And the official guidelines from groups like the British Thoracic Society, well, they don't mince words. Just look at this table. The hazard, unauthorized adjustment of flow rate. The consequence, worsening respiratory failure. It really doesn't get much more direct or serious than that. We're not talking about a minor side effect here. This is a critical risk. And listen, this isn't something that happens over weeks or months. We're talking fast. That dangerous buildup of CO2 can happen surprisingly quickly, sometimes within just a few hours of turning up your oxygen too high. And it's especially risky when you're sleeping, because your breathing naturally changes, and you're just not aware of these subtle, dangerous shifts that are happening inside your body.
Okay, so since this can sneak up on you, especially when you're sleeping, you absolutely need to know what to look for. There are some very clear warning signs, and spotting them could literally be a lifesaver.
Here are the key things to watch for. A big one is just increasing drowsiness, feeling way more sleepy than usual, or confusion, just not feeling as sharp. Morning headaches are a classic sign that you've been retaining CO2 overnight. And here's the really tricky one, you might actually feel more breathless even though you've turned the oxygen up. All of these are huge red flags that your body might be struggling with too much CO2.
So what do you do if you notice any of these things? The advice is simple, and it's urgent. Don't wait. Don't try to fiddle with the dials and fix it yourself. You have to call your respiratory team or your doctor right away. This is a real medical issue that needs a professional to sort out. All right, we've gone through the risks, we've talked about the warning signs. Let's finish up with the most important part. How do you stay safe in the first place? Well, it all comes back to trusting the science and trusting your prescription. So, is it ever okay to adjust your oxygen? The answer is maybe. But, and this is a huge but,
It's only safe if your clinical team has given you a very specific plan to do so. For example, they might tell you to adjust the flow to keep your oxygen levels in a target range. But if your prescription is just a fixed rate, let's say 1 liter per minute, you should not change it. Bumping it from 1 liter up to 2 or 3 just because you feel like it is considered unsafe, period.
If there is one thing you take away from all of this, let it be this. When it comes to medical oxygen, more is not better. The right amount, that very specific number prescribed just for you, is what's best. That's the safest way.
So here it is, your simple action plan. Number 1, always use the flow rate your team prescribed. Number 2, if they gave you a target oxygen saturation range, know what it is. Number 3, if you feel like you need a change because you're more breathless or your levels are low, don't do it yourself. Call your medical team and ask for a review. And finally, number 4, please never buy and use oxygen you find online without a prescription. It's just too dangerous.
So we end on this question. Your home oxygen is an amazing, life-changing therapy, but it is powerful. And to make sure it's always helping and never harming, the answer isn't in turning up the dial. It's written right there, on your prescription. Trust the experts, follow their guidance, and please, stay safe. Thanks for tuning in.